translating this simultaneously in the 6 official UN languages plus Portuguese and Hindi. And we will be posting the Director General's remarks and an audio file of the press conference on the web as soon as possible, and transcripts will also be available later. So now, without further delay, I will hand over to Dr. Tedros to give us his opening remarks. Dr. Tedros, you have the floor.
Thank you, Margareta, and welcome. And I would also like to use this opportunity to thank Fedila, who has been moderating until today. Good morning, good afternoon, and good evening. With the latest positive news from vaccine trials, the light at the end of this long, dark tunnel is growing brighter. There is now real hope that vaccines, in combination with other tried and tested public health measures, will help to end the pandemic. The significance of this scientific achievement cannot be overstated. No vaccines in history have been developed as rapidly as this. The scientific community has set a new standard for vaccine development. Now, the international community must set a new standard for access. The urgency with which vaccines have been developed must be matched by the same urgency to distribute them fairly. Every government rightly wants to do everything it can to protect its people. But there is now a real risk that the poorest and most vulnerable people will be trampled in the stampede for vaccines. That's why in April, with support from multiple partners, WHO established the Access to COVID-19 Tools Accelerator. The ACT Accelerator has supported the fastest, most coordinated and successful global effort in history to develop vaccines, diagnostics, and therapeutics. More than 50 diagnostic tests are being evaluated, and new rapid antigen diagnostics are being made available for low and middle-income countries. Life-saving dexamethasone treatments are being rolled out, and new medicines, including monoclonal antibodies, are being tested. And 187 countries are now participating in the COVAX facility to collaborate on the procurement and rollout of vaccines, ensuring the best possible prices, volumes, and timing for all countries. Importantly, COVAX is also analyzing and supporting the systems for delivering vaccines and other COVID-19 tools, which have been mapped in 4 regions. And we're rolling out other tools like the WHO Academy's new augmented reality course for health workers on the correct use of personal protective equipment. However, only a fundamental change in funding and approach will realize the full promise of the ACT Accelerator. $4.3 billion is needed immediately to support the mass procurement and delivery of vaccines, tests, and treatments. A further $23.8 billion will be needed next year. This isn't charity. It is the fastest and smartest way to end the pandemic and drive the global economic recovery. The International Monetary Fund estimates that if medical solutions can be made available faster and more widely, it could lead to a cumulative increase in global income of almost $9 trillion by the end of 2025. The real question is not whether the world can afford to share vaccines and other tools. It's whether it can afford not to. At the G20 Leaders Summit on Saturday, it was very encouraging to hear world leaders expressing their support for WHO and their commitment to the ACT Accelerator. Thank you. In September, WHO established a facilitation council for the ACT Accelerator to leverage high-level political commitment to put the tools to defeat COVID-19 in the hands of the people who need them most. Today, we are honored to be joined by the two co-chairs of the ACT Accelerator Facilitation Council, His Excellency Dag Inge Ulstein, Minister of International Development of Norway. Tack så mycket, tack ska du ha, and Dr. Zweli Mikize, Minister of Health of South Africa. Minister Dag Inge Ulstein, welcome, and you have the floor. Tack ska du ha again.
Thank you so much, and good evening, Dr. Tedros. By the time I have presented my speech today, many people have received a positive COVID-19 test. Others have been told that their loved ones did not make it. As of today, there are more than 55.5 million confirmed cases, more than 1 million deaths. Every second matters. This pandemic is not going away if we sit still and do nothing. Moreover, it is not going away if some countries only are taking a my nation first approach. Such vaccine nationalism is not only morally reprehensible, it is also a stupid thing to do. Because already heard many times, we are not safe until we are all safe. Our economies will continue to bleed money if countries with a large number of cases lag in obtaining the vaccine and other medicines. We are in this together, and the solution is only achievable if we work as one team, and yes, time is running out. This is not only a health crisis. It is an economic crisis, it is a nutrition crisis, it is a protection crisis, it is a humanitarian crisis. I could have gone on and on and on. The real world ramifications of the pandemic are all too clear to see. Every day jobs are being lost. The ILO estimates that 495 million full-time jobs will be lost in the second half of 2020. Every day people are being pushed into extreme poverty. The World Bank estimates that this could be the case for an overwhelming 150 million people. 150. Every day, children around the world are sitting at home as their schools are closed in an attempt to contain the global pandemic. This has taken 1.6 billion students out of classrooms around the globe. For millions of girls and young women, particularly those in the world's least developed countries, school shutdowns bring other risks such as domestic violence and sexual abuse. This pandemic affects us all, but it does not affect us all equally. UN Chief Antonio Guterres warns that the impact of the COVID-19 pandemic are falling disproportionately on the most vulnerable. People living in poverty, the working poor, women and children, persons with disabilities, and other marginalized groups. This is easy to forget as we are all faced with COVID fatigue. So now is not a time to feel sorry for movie time lost, parties not attended, or dinner parties postponed. We owe the most vulnerable that we do whatever we can to end this pandemic. The human costs of not acting are obvious. So are the economic consequences. We heard some of the numbers. The IMF foresees $11 trillion will be lost in GDP in 2021. Behind these forecasts lie businesses, jobs, local communities, families, and individuals. As economies bleed money, futures are stolen, educational opportunities lost, mental health issues are rising. The sooner we get the pandemic under control, the sooner we can reopen societies and the global economy back on track. To stop the pandemic, we need to ensure that effective diagnostics, therapeutic drugs, and vaccines are not only developed. To stop the pandemic, we need to ensure these tools are distributed to people around the world. If we are to succeed in this, we need to engage with civil societies, humanitarian organizations, and private sector. And yes, there is hope. We have tests that provide results in less than 30 minutes now. We have better knowledge of how to treat the disease. We have a wide portfolio of vaccine candidates on the cusp of finalizing phase 3 trials. We need to make sure that we do not end up with having these tools, but not the infrastructure to make them available to all. Fortunately, there is a clear path forward, and that is the Access to COVID-19 Tools Accelerator, ACT-A. This initiative was set up to promote equitable global coverage of vaccines, tests and treatments, and strengthen the health systems. In just 6 months, ACT Accelerator partners have compiled the world's largest portfolio of these tools. To continue rolling out rapid testing, evaluating new treatments, and ensuring access to vaccines as soon as they are licensed, the ACT Accelerator urgently needs 4.3 billion and a further 23.9 billion in 2021. So we have a problem, we have a solution, now we only need to make it work. I would argue that this is a no-brainer for the world leaders. $23.9 billion sounds a lot, yet the total need is less than 1/10 of 1 percentage point of global GDP. In other words, if G20 countries were to devote just 1% of their current stimulus spending on efforts to alleviate the economic consequences of the pandemic globally, they would actually more than cover the needs of the ACT Accelerator. I would argue that this is a small price to pay to getting the world back on track. Once full travel and trade are restored, that investment would be repaid in as little as 36 hours. 36 hours. I think we all know that the cost of inaction far outweighs the cost of action. So this is the best business case ever, and it is the only way. There is no plan B. So each dollar, pound, euro, yuan, and yen spent on the accelerator is underwriting future demands for goods and services so that global trade and growth can bounce back. In a letter sent last week from South Africa, Norway, the European Commission, and WHO, we called on the G20 countries to consider support to the global COVID-19 response as part of their domestic stimulus spending and to contribute substantial amounts to fully fund the ACT Accelerator. And as the G20 summit in Saudi Arabia closes, I think we can say that we are being heard. The 20 biggest economies vote to spare no effort to supply COVID-19 drugs, tests, and vaccines to all people. Yes, we still have a long way to go, and the pledging marathon will continue. However, I think the recent news about coronavirus vaccines and the strong support from the G20 meeting addressing the need for solidarity and multilateral cooperation makes me truly believe that we can allow optimism fuel our next steps. Yet, only a fundamental change in funding and approach will turn new hope of technological achievements into an effective weapon against the virus and allow us to change the course of the pandemic. I trust that every world leader see that this problem is not solvable if we don't collaborate. The cost of inaction and the human consequences of prolonging this pandemic should be incentive enough. So, to end, it's amazing what we have actually achieved so far. Despite many ongoing conflicts in the world, despite difficult topics, all countries are somehow united in this. Yes, when it comes to the ACT Accelerator, we are actually still sitting around the same table. Yet we come to the table with different perspectives and different needs. But so far, everyone has been willing to listen, to stretch, to try to understand and meet each other, because we understand how closely intertwined our countries and people actually are. The ultimate goal becomes so much more important than just launching the best and right solution for ourselves. So with that said, back to you, Dr. Tedros. Thank you.
Thank you, thank you. Thank you so much, Minister Ulstein, for your support and commitment. And as you said, I fully agree, the best case ever, and it has to be supported. Thank you so much again. It's now my great honor to introduce Dr. Zweli Mkhize, Minister of Health of South Africa. Your Excellency, welcome, and you have the floor. Thank you so much for your support also. Thank you.
Thank you very much, Dr. Tedros, the Director General of the WHO, and all the members of the WHO team, my colleague, the co-chairperson, Minister Doug Inge Olstein. Thank you very much for the opportunity to be part of this very special occasion, this briefing. If there was ever a case for solidarity and global cooperation, this COVID pandemic has demonstrated one. The crisis is hitting the world hard and our most fragile regions harder, affecting income, health, education, and other parts of our socio-economic lives. COVID-19 does not respect national boundaries, and as long as it exists anywhere, it is a threat everywhere. No one is safe until everyone is safe. Global solidarity isn't just the right thing to do. It's the smartest thing to do, ensuring that tools are allocated equitably, not based on income, but based on universal protection against COVID-19, is the fastest and most effective way to defeat the pandemic and get our lives and our economies back to normal again. We must treat access to COVID-19 tools as a global public health initiative. Collective efforts to stamp out the virus now would also mean that future deadlier strains or mutations that are more difficult to treat could be avoided. It is clear that every country will need to play a part in financing an end to this crisis, and every leader has a political choice to make. But the lack of adequate financing for our global exit strategy, the ACT Accelerator, is an existential threat to the economic and health security of all countries and their citizens. Speaking from the perspective of the African continent, it has now recorded over 2 million cases with 49,000 deaths, which is accounting for 2.5% of the global caseload. There are early signs of resurgence as 18 countries, which is 38%, more than 20% increase are recorded in numbers the last 7 days when compared to the previous 7 days. It's also not certain how a resurgence on the African continent will evolve, and therefore early equal access to vaccines and therapeutics will be critical in mitigating the threat posed by the resurgence on the continent. As part of these preparations, President Ramaphosa, His Excellency, as Chair of the African Union, established a COVID-19 African Vaccine Acquisition Task Team to lead this effort. In addition to equitable access to COVID-19 tools, we also need to pay attention to the strengthening of health systems. The ACT Accelerator offers a clear way forward for ending the crisis through global cooperation that will deliver all countries need to end the acute phase of the pandemic, restoring economic vitality and averting catastrophe. And whilst the pace of scientific research and development into effective vaccine therapeutics and diagnostics is unprecedented, its true value will only be realized if countries can access these tools and are prepared for their use. Every country has work to do to ensure that once ready, these tools can be rapidly deployed. This includes ensuring that capacities and infrastructure that need to be radically scaled or upgraded to deploy COVID-19 tools are ready and working. Bottlenecks in key areas of health systems such as data, workforce, clinical care, supply chains, as well as access to key commodities such as PPEs, oxygen, remain limiting factors to effective deployment and use of COVID-19 tools in many countries. The Health System Connector pillar of the ACT Accelerator is the critical mechanism to support countries to bolster and strengthen through a tailored approach that uses global knowledge to address local problems. Countries' readiness is an absolute prerequisite to the equitable scale up of the COVID-19 tools. It is a hurdle we must clear if we are to win this race. And this is one time